I'm Dr. Reid Wilson, and thanks for watching for these first few minutes. I'm going to teach you, if you're using our app, how to score a point. Let's think for a minute around the anxiety disorders, whether you have panic disorder, social anxiety, general worries, or even OCD or specific phobias. This is a mental challenge, and your challenger, we want to externalize that and put it outside of you. And when we are scoring points, we're working moment by moment in responding to either a sense of uncertainty or distress and anxiety. So here's how you score a point. First, of course, if you're going to create a practice, you want to be figuring out what you can do to generate some degree of uncertainty or distress about your theme. At other times, it's just going to happen spontaneously. You won't have planned this at all. When it occurs, and that may be you beginning to get anxious around anticipating the event, really important to notice those times, or in the middle of the event, or even after it's over, starting to have second guesses about what you did or what you said and become anxious and uncertain about that. Any of those moments, when they start to bother you, the first thing you want to do is step back. And what that means is you want to separate yourself a moment from your obsession or your worry or your focus on your uncomfortable physical sensations and just name it. You say inside your mind, oh, I'm doing it again, or here it is, or time to practice. So once you step back, I want to make sure you understand there's nothing you're going to be able to do therapeutically in those moments unless you step back. Once you step back, I want to encourage you to say something to yourself. And there's three things you can say. Whatever they are to encourage you to keep moving forward in this task in the face of doubt and distress. So the first thing that you would say would be some words of encouragement. You might say, I'm going to do this, or I can handle this, or I want to be doing this practice. It's going to make me stronger. So any message that encourages you to continue to move forward would be useful. Another option you have to say instead of that is to give yourself an instruction about what to do at this moment, sometimes even a command. So for instance, if you have social anxiety, you might say to yourself, go ahead and speak up. Or you might tell yourself, raise your hand now, get called on. If you have panic disorder and you're beginning to have a panicky moment, you may want to be instructing yourself to don't leave. Just sit here for a little bit. Wait it out. And if you're having obsessions or worries that are noise and not a signal, you might say, just forget that, or I'm not listening, or some other time. The third way you could talk is more cunning, which is that you actually talk directly to the disorder. Anxiety disorders, OCD, have a very particular way they want you to respond to your discomfort and your uncertainty. And that is to push it away, to get rid of it, to try to tamp it down and get it to stop. So you can actually, in this kind of cunning move, talk to the disorder and ask the disorder to increase whatever it is you're currently afraid of. If you feel like your heart rate is beating so fast that it's scaring you, you can say, hey, come on, panic, make my heart beat faster. Or come on, OCD, give me another thought like that. Can't you scare me more? Now, when you reassure yourself or when you tell yourself what to do, those are honest messages. You really want to believe what you're saying. When you're talking in a cunning way to the disorder, you're not really meaning, please give me more. But the whole cornerstone of people being stuck in anxiety is their resistance. So if you can stop resisting and actually invite, it's a way for you to begin to get better. Once you've had those statements, it's very important to pay attention to the self-talk. Then turn your attention away from that little dialogue. This has been one set of transactions, and that transaction is over. Go back to your valued activity, your task right now, whether it's continuing to read that book or listening in class or driving the car or just trying to get to sleep. As soon as you've turned away, you just scored a point. If you're using that app, you just press the middle of the app and you've scored it. Now, granted, 8 seconds later, you may get uncomfortable again. You may have that thought that you don't want to have again. If you're playing the game like I would like you to, then as soon as that happens, you can go great. It's crazy to think about saying great at that moment. But if your job is to score as many points as possible today, then having another uncomfortable sensation, having another set of doubtful thoughts and feelings give you another chance to score another point. So welcome it and start again. That's how you score a point in this game. If you want to learn more about how to do all of this stuff, there's lots of details in part 3 of my book, which is called Stopping the Noise in Your Head. Thanks for listening. Go get 'em.